Welcome back to OncoTrial Insight with Dr. Pidugu. I'm your host, Megan, and today we're diving deep into some really interesting research happening in the world of neuroendocrine tumors. Specifically, we will be discussing the Cabozantinib trial, which evaluated Cabozantinib in advanced neuroendocrine tumors, or NETs, and I'm thrilled to have Dr. Pidugu joining me today.
Thanks, Megan. It's great to be here and chatting with our listeners. Just a quick heads up before we get started. The views expressed on this channel are mine alone and don't represent any institution or employer. This content is for educational and informational purposes only, so please consult your own healthcare provider for any medical decisions. My goal here is to provide you with educational content, shedding light on various topics.
Absolutely crucial disclaimer, Dr. Pidugu. Now let's jump into the Cabozantinib trial. It's generating a lot of excitement in the NETs community, especially after a recent publication in the New England Journal of Medicine. We're focusing on the use of Cabozantinib in patients with advanced neuroendocrine tumors. For our listeners who might be less familiar, neuroendocrine tumors are a somewhat less commonly discussed group of cancers. Could you briefly explain what they are and why advancements in their treatment are so important?
Certainly. Neuroendocrine cells carry messages from the nervous system to the endocrine system. In response to these messages, the endocrine system makes and releases hormones into the bloodstream that control body functions like blood pressure, heart rate, digestion, breathing, and blood sugar levels. Neuroendocrine tumors, NETs, are a group of relatively rare tumors that originate from neuroendocrine cells and peptidergic neurons, which possess both nervous system and endocrine functions. The incidence of NETs in the USA has shown a significant increase over the last 2 decades. Between 2000 and 2018, the age-adjusted incidence rate per 100,000 persons rose from 4.90 to 8.19, representing an annual percentage change, APC, of 3.40. This increase was particularly pronounced for grade 1 tumors, localized stage disease, and tumors originating in the appendix. These tumors are highly heterogeneous and can occur in various parts of the body, although they are most frequently found in the lung, gastrointestinal tract, and pancreas. While many NETs are indolent and slow-growing, some can be aggressive and prone to metastasis. Higher tumor grades, G3 and G4, and later disease stages, regional and distant, as being associated with a worse prognosis. Among these, disease stage and grade were found to be the most significant risk factors influencing survival. Historically, treatment options for advanced NETs have been somewhat limited, often relying on therapies like somatostatin analogs, targeted therapies, and sometimes chemotherapy. Unfortunately, many patients experience disease progression, highlighting the urgent need for new and effective treatments.
That really underscores the importance of new options. Now, Cabozantinib isn't entirely new. It's already approved for indications like renal cell carcinoma and hepatocellular carcinoma. How does it fit into the picture for neuroendocrine tumors?
That's a great question. Cabozantinib is a multi-targeted tyrosine kinase inhibitor. Essentially, it blocks vascular endothelial growth factor receptors, AMAT, AXL, and NRT, which are involved in tumor growth and angiogenesis, or the formation of new blood vessels that feed tumors. In NETs, especially after standard therapies like everolimus or somatostatin analogs have been tried, treatment options are quite limited. Some early phase studies suggested that Cabozantinib might have activity in NETs, and that really set the stage for the Cabozantinib trial.
Absolutely. And that brings us to the exciting news from the Cabozantinib trial, which evaluated the drug Cabozantinib. Can you tell us a bit about this trial and its purpose?
The Cabozantinib trial was a pretty big deal. It was a phase 3 study that was double-blind, placebo-controlled, and conducted across multiple centers. What made it unique was that it included 2 separate randomized groups, one with pancreatic neuroendocrine tumors, PNET, and another with extrapancreatic ones, EPNET, totaling 298 patients. All of them had advanced or metastatic disease that had already progressed despite earlier treatments. So we're talking about a particularly tough to treat population where options start to run thin. What's interesting about this trial is that it ran both groups in parallel. The PNET group had 99 patients, and the EPNET group, those with tumors starting outside the pancreas, like in the lungs or GI tract, had 199. Patients were randomly assigned to take either 60 milligrams of Cabozantinib daily or a placebo. The main thing the researchers wanted to find out was how long patients could go before their disease got worse. That's what we call progression-free survival. They were also keeping a close eye on overall survival as a key secondary outcome.
So these are patients who've already gone through other treatments and unfortunately seen their cancer continue to grow. How did Cabozantinib perform?
The results were really promising. Patients who received Cabozantinib had a significantly longer time before their cancer progressed compared to those on the placebo. In simple terms, it helps slow down the disease, and that's a big win in this setting.
That's really encouraging to hear. And the trial also looked at objective response rates, right? What did they find there?
Yes, they did. Focusing on the pancreatic NET group specifically, the objective response rate, meaning the percentage of patients whose tumors actually shrank, was 19% with the Cabozantinib. With placebo, it was 0%. And just to clarify for our listeners, objective response means there was a confirmed partial or complete tumor shrinkage based on an independent review. So even though that 19% only applies to the pancreatic group, it shows that Cabozantinib can actually shrink tumors in some patients.
Wow, that's impressive. Let's dig into the numbers a bit more. What were the actual results?
Sure. For patients with pancreatic NETs, the median progression-free survival, basically how long patients went without their cancer getting worse, was 11.4 months with Cabozantinib, compared to just 3 months with placebo. That's a hazard ratio of 0.27, which is quite significant. In the extrapancreatic NET group, the median was 8.3 months with Cabozantinib versus 3.2 months with placebo, with a hazard ratio of 0.34.
That's a big improvement across the board.
It really is. These results strongly suggest that Cabozantinib could become a valuable treatment option, especially for patients whose disease has progressed despite earlier therapies.
That's a pretty big difference. Now, Cabozantinib is known as a multi-tyrosine kinase inhibitor, but for those of us who aren't scientists, can you break that down? What does that actually mean and how does it help?
Absolutely. So one of the key things tumors do to grow and spread is build new blood vessels, a process called angiogenesis. Cabozantinib is a small molecule taken by mouth that blocks several specific proteins. And tyrosine kinase is like vascular endothelial growth factor receptors, MET, AXL, and RET. These proteins play roles in both angiogenesis and tumor growth. By targeting multiple pathways at once, Cabozantinib can cut off the tumor's blood supply and also interfere directly with cancer cell growth.
Got it. So it's really attacking the cancer from different angles. But like with any drug, there are usually side effects. What did the Cabinet trial find on that front?
Yeah, that's important to talk about. Like other tyrosine kinase inhibitors, Cabozantinib does come with some side effects, and they can be significant. In the extrapancreatic NET group, about 62% of patients on Cabozantinib had grade 3 or higher side effects. That's compared to 27% with placebo. The most common ones were high blood pressure, 21%, fatigue, 13%, and diarrhea, 11%. In the pancreatic NET group, it was a similar story. 65% of patients on Cabozantinib had grade 3 or higher treatment-related side effects versus 23% on placebo. We also saw high blood pressure, 22%, fatigue, 11%, and thromboembolic events like blood clots, 11%.
So definitely some side effects to be aware of, but it sounds like they're manageable?
Exactly. A lot of patients were able to stay on treatment with dose adjustments or short breaks when needed. It really comes down to careful monitoring and tailoring the approach to each individual. And stepping back a bit, the results from the Cabinet trial are pretty impactful. They make a strong case for Cabozantinib as a new treatment option for patients with advanced pancreatic or extrapancreatic neuroendocrine tumors, especially after other treatments like peptide receptor radionuclide therapy or targeted drugs stop working. This trial gives new hope to a group of patients who haven't had many good options. It also gives clinicians another much-needed tool to help manage this tough disease.
Every trial has its limitations. Were there any in Cabinet that we should keep in mind?
Yes, definitely. One thing to note is that the trial was stopped early because the results from the interim analysis were so positive. While that's encouraging, it can sometimes lead to an overestimation of how effective the treatment really is. Also, the study used a placebo instead of another active drug for comparison. And finally, the overall survival data weren't fully mature yet, so we'll need more time and follow-up to see how things play out in the long term. There is also the possibility that patients crossed over to other treatments afterward, which can affect those results too.
Still, it really sounds like an important step forward. Dr. Pidugu, what would you say is the main takeaway from the Cabinet trial for patients and their families dealing with advanced neuroendocrine tumors?
The big message here is hope. Cabozantinib showed a real benefit in slowing down disease progression for patients who'd already been through other treatments. Yes, there are side effects that need to be managed carefully, but it offers a meaningful new option, something that could help patients live longer without their disease worsening. Of course, every treatment decision should be personalized based on the patient's specific situation. But the Cabinet trial gives strong evidence that Cabozantinib is worth serious consideration in this setting.
Overall, how do you see these results shaping clinical practice moving forward?
The Cabinet trial gives us strong evidence that Cabozantinib is a meaningful treatment option for patients with advanced pancreatic or extrapancreatic neuroendocrine tumors who have already been through other therapies. It showed a significant improvement in progression-free survival, and the safety profile was consistent with what we've seen in other uses of the drug. This is a big deal because it helps fill a treatment gap, especially for patients whose disease has progressed after therapies like Lu-177 dotatate or other targeted agents. That said, a treatment decision still need to be individualized. Not every patient is the same, and figuring out the best sequence of therapies remains an open question. There's definitely more work to be done to optimize how and when we use Cabozantinib. Based on the data from Cabinet, the FDA approved Cabozantinib on March 26, 2025 for adult and pediatric patients 12 years and older with previously treated unresectable, locally advanced or metastatic, well-differentiated pancreatic or extrapancreatic neuroendocrine tumors.
Dr. Pidugu, thank you so much for breaking this important research study for us. It's truly encouraging to hear about advancements like this that can make a real difference in the lives of patients with neuroendocrine tumors.
Thank you, Megan. It's always a pleasure to share these updates and, most importantly, to bring some optimism to the patient community.
That wraps up our conversation with Dr. Pidugu on the exciting results from the Cabinet trial and what they mean for patients with advanced neuroendocrine tumors. Thanks for joining us on OncoTrial Insights with Dr. Pidugu. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with your colleagues or anyone who might find it helpful. We'll be back soon with more updates on the latest clinical trials and advances in cancer care. Until then, stay curious, stay informed, and keep pushing for better outcomes.